I'm Dr. Dan Casasilla with Sarasota Neurology. I'm a board-certified neurologist and I have been practicing in the Sarasota area for over 20 years. Because I'm an osteopathic physician, I tend to see a lot of patients that have joint pain. They come to me with complaints of knee pain, ankle pain, hip pain, shoulder pain. I see those kind of joint pains all the time. As an osteopathic physician, I practice non-surgical neuroorthopedics every day in my practice. And we have different treatments that we can do for that, but the most important treatment that is really current, novel, cutting-edge medicine is a treatment known as platelet-rich plasma. It is where we take your own blood from your arm right in our office. We put this in a special centrifuge and we extract out the pure healing component of the blood. So we take out about 2 ounces of blood, we spin it down in the centrifuge, and we get about 10 cc's, which is about 10 thimblefuls full of pure concentrated platelet-rich plasma, or PRP. That is the pure healing substance contained within your blood, and it's your own blood, so it's very safe. The complication rate of getting PRP is extremely low, and it has about an 80% success rate in treating patients that have different joint pain. So if you have knee pain, or you have a torn cartilage, or the same thing in your shoulder, you have joint pain, impingement syndrome, or torn cartilage, you have an ankle sprain that won't go away, we can take that PRP, that concentrated healing fluid from your own blood, and inject it right into that joint under anesthesia, so it's not really a painful procedure, and it will heal naturally, and the healing is actually stronger than the original tissue itself because PRP regenerates and grows new tissue, so if it needs to be a tendon, ligament, or cartilage, it'll regrow that because it incorporates stem cells into differentiating into that tissue, and it heals naturally, and it's amazing therapy. It's non-invasive really, other than the little shot, but it doesn't require surgery. There's no downtime. It's done in our office, and you're in and out of our office inside of an hour. And the really other interesting part is there is no physical therapy or rehabilitation. The healing occurs naturally, and you can go about your life without having any other treatment. I do the PRP treatment, say see you in 8 weeks, and the patients come back. And I will tell you, it's been my clinical experience that about 80 to 85% of the patients come back and they're dramatically better, if not completely cleared of their pain. Other conditions that can be treated with PRP are patients that have failed back syndrome or post-laminectomy syndrome, where they've had neck or back surgery that has failed and they have persistent neck or back pain that hasn't cleared up. They're going to see pain management doctors and they're on narcotics and they've had epidural steroids and nothing's working, and they want to get off of the narcotics because they don't feel well on narcotics. Narcotics basically paint over the pain, but they don't get rid of it. The interesting thing about PRP is that we can inject patients with their own PRP, again made from their own blood, into the spinal region, in the soft tissue, in the muscles. So this is not a spinal injection. It goes into the soft tissue muscles on either side of the spine, and we can selectively choose where to inject that PRP, either in the neck or back, and then again, it will naturally heal the damaged tissue that is in your neck or back, resulting in pain relief. Again, that's an outpatient procedure. There's no downtime. There's no general anesthesia. You come in the office 1 hour later, you walk out, and the healing occurs over 8 weeks, and there's no rehabilitation. It's great. Other conditions that can be very well treated with PRP include plantar fasciitis and painful heel spurs. Foot pain is a very common condition in the United States. 1 out of 5 Americans suffer from some type of foot pain. A lot of that is plantar fasciitis, which is inflammation of the bottom of the foot, or a heel spur. We can take your own PRP, make it again right there in the office, numb up the bottom of your foot, and inject PRP right where the plantar fascia is, which is that long piece of tissue that supports the bottom of your feet, or we can inject the PRP right around the heel spur that's on your heel, and the PRP will actually help reduce the heel spur. That's been shown by x-ray studies to reduce the heel spur, and it actually heals plantar fasciitis. I've even treated patients with torn plantar fascia, and it regrows new plantar fascia and gets rid of their pain. I would say that my success rate in treating patients with plantar fasciitis and PRP is at least 90%. If you're suffering from head, neck, or back pain, or any kind of joint pain, don't hesitate. Call Sarasota Neurology at 941-955-5858 for an appointment. You'll get an objective consultation. It does not commit you to any other treatment, but at least you'll have your treatment options which do not involve surgery or narcotics. Call now at 941-955-5858 or visit us online at sarasotaneurology.com.